further ado, let's rock and roll.
All right.
All right. First and foremost, where are you from? Let's talk about your background leading up to the military service and why you chose to do this.
All right. Colorado is my true home,
Okay.
but I lived for a long time in Albuquerque, New Mexico,
Okay.
so I can claim either one. So I was always on track to be something medical, but I wanted to be a flight medic,
Gotcha.
so more down the paramedic type route. And I was an EMT at one point, working towards it. I was working as a tech in a hospital, and
I'm an EMT too.
Oh yeah, there you go, exactly.
Okay.
But it was all the nurses there, because I always said I would never be a nurse. But
Right.
all the nurses there said, don't do that. Go be a nurse. You can fly and be a nurse if you want to. And you can, you know, if a nurse burns out in one section, we can always just flip, you know, do peds, adults, this, that. So I went ahead and got into nursing school and did that. And I'm actually a little different than most. I was a nurse on the outside before coming in, so I'm a direct commission.
All right, fully qualified.
Yep.
Okay.
And the opportunity just kind of just fell in front of me. And I took it. I always thought that'd be kind of cool thing to do, and ran with it. So,
Okay.
yeah.
How did you hear about us? So yeah, that leads me to my next question. How did you join? Let's talk about the recruiting experience. Because in your case, you were fully qualified. So
Yes.
It wasn't ROTC. You weren't prior enlisted.
Nope.
Walk us through that process, the recruiting process.
Yeah, so was in a recruiting office actually for somebody else who was going to join. They ended up who was not medical, didn't end up being candidate, and they kind
Were they
of.
going to go medical or were they going enlisted?
They would have been coming in enlisted at the time, but the recruiters looked at me like, "What about you?" And I was like, "I'm a nurse."
Right.
Like, "Oh, we got a recruiter for you." You know, the health professions recruiters.
Yeah.
So I went down, just started talking to them, and it, like I said, it just kind of took off from there. So I was a critical care nurse on the outside, and so. I came in directly to critical care, not having to go through nurse transition program, which a lot of nurses need to do, and took off from there.
So coming in that route, let's talk about OTS. Did you go through a condensed version of OTS, like a COT, or did you go through full OTS?
I went through COT,
Okay.
and I can't remember now at the time if 6 to 8 weeks, I know it keeps fluctuating, was the time for that.
Okay.
And then I got credit for however many years I was a nurse on the outside. They cut that in half.
Absolutely.
So I almost wasn't a second lieutenant, but for like a couple months.
Right.
So automatic to first.
Right. So anybody asking questions about that, for fully qualified, what we as nurse recruiters do is we look at what is their medical service grade coming in, right? So how much work experience do they have, qualifying work experience within the last 6 years? You know, if that's 6 years, you're going to get 3 good years out of that. If there's a degree in there outside of your undergrad, whether it be a master's or a doctorate, obviously that comes into play too. So the doctorate you would get credit for, the master's you would get credit for as well. Did you have just the bachelor's coming in? Mm-hmm. Okay.
Yes.
So fully qualified crit care. And when you came in crit care, not flight nurse, not ER?
Nope. Went right to the ICU at Travis.
All right, Travis. Specialty, we've talked crit care. What do you do? Actually, so crit care coming in all the way to chief nurse. So obviously you've come a long way, 17 years. Let's speak more to the crit care side of the house versus the chief nurse side of the house.
Okay.
What is a crit care nurse doing in the Air Force? Let's speak to your specialty.
So you almost have two sides to it. So when we're, here at home station in the ICU, pretty standard, almost same as civilian nurses, same type of patients. They're going to see the ventilators and all of your drips and things. But the difference is when we deploy.
Okay.
Huge difference. The injuries that we see, a civilian nurse probably will not ever get to see. You may have a nurse at a level 1 trauma center somewhere, but the amount of amputations we're going to see, or the burns where we get to see, it's very different. It's sad, of course, but trauma nurses also thrive on that adrenaline rush, and they kind of want to see those things and deal with it. So we get a much more extensive, different trauma background.
Okay.
than they will.
Yeah, I would imagine. So going from crit care to where you're at now, being a chief nurse, I mean, what does a chief nurse do in the Air Force, and how did you get there?
So the chief nurse overall, so they are part of the executive staff with the other commanders and whatnot, but we are more the mentors and career guidance. So I'm making sure, for one, all the nurses are meeting the standard of care and doing all the things they should do for practice correctly. But also trying to steer their career and get them to where they want to be. Do they want to be on a clinical track, on an education track, a leadership route? And I guide them in which way they want to go.
So chief nurse on the civilian side, is there an equivalent? Like, what would be a chief nurse on the civilian side?
Nurse executive.
Okay.
Yep.
Gotcha.
Sometimes some places will still call it a chief, but a nurse executive officer.
So in your case, being military 17 years, how long did it take you to get where you're at now into a chief nurse spot?
15 years.
Okay, so 15 to chief nurse. Civilian side, do you know how long that would take someone?
I don't know exactly. I think it would vary.
Okay.
I think a lot of those nurses have more probably degrees on the business side.
Okay.
And you also have to want to have it, because some nurses want to stay clinical and some want to kind of go down that route.
Okay. Let's talk assignments. Where have you been? Where are you going? Is this the last one? Is there more? But let's go back to the beginning.
All right.
Where did you start?
So I started at Travis here in Northern California. I was 3 years there in the ICU. And after that, I went to Scott Air Force Base in Illinois, and that is when I went to fly. So my civilian nurses were right. You can still fly and be a nurse. Cool. So Aeromedical evacuation, and I stayed there for 6 years, a little longer, only because PCAing, permanent change of assignment, I was staying put. Headquarters for AE is at Scott, so stayed there a little longer than normal. After that, believe it or not, I got an assignment to Kirtland Air Force Base, right back in Albuquerque, where I joined from. I was a position called a HCI, Healthcare Integrator. Okay. So it's in a outpatient clinic. They have HCIs and inpatient as well. They're kind of over what we call HEDIS metrics, all your preventative cancer screenings, those kinds of things. Okay. Went from there to Eielson Air Force Base, Alaska, and I was the family care flight commander there. So large flight, outpatient clinic, and then from there, here. Gotcha. And I will be here 1 more year, and then I don't know where I'm going next. Gotcha. So 2 more years after here. Yep.
Out of all those, which has been the best?
Oof, it's tough. So for the job, I liked flying. AE, the best, because you get out and about more. You're all over the world. Completely different from anything you're going to see on the civilian side.
Scott.
That is at Scott. Okay. And it's not the same when an Air Force nurse is a flight nurse. It's not on a helicopter, which is what a civilian flight nurse would more likely be doing.
Yeah, that's totally what I
Yes, yeah. So we are in the back of the large fixed wing aircraft, turning it into like a little hospital back there.
Gotcha. So it could be C-130, could be C-17.
Yep,
could be
absolutely.
C-5. Okay.
Yep, all of the above.
Okay.
Best location though was actually Eielson, which my family laughed at me because I don't like cold.
Which is surprising because I
know.
was in the middle of nowhere.
It is, but I wanted it because everybody who goes to Alaska loves it. A lot of people retire there. They go back there. So I was like, I got to go see what's going on with Alaska.
And New Mexico's home?
Between Colorado and New Mexico, I will eventually retire.
Cold.
Yeah, I used to be, and then I prefer heat. Gotcha. But Alaska is beautiful, absolutely beautiful. It's just different world.
Did you see any moose when you were there?
All the time. All the time.
State bird, mosquito?
Yes.
Okay, continuing from assignments, let's talk travel opportunities. Let's talk TDYs, fellowships, humanitarians, deployments. Doesn't have to be all those. Let's just speak on some of those travel, whether it be humanitarian deployments or TDY for training.
All right, so I'll go with deployments first. I've deployed 5 times. Okay. AE deploys more than if you're just working in a hospital or clinic.
AE being Aeromedical Evac.
Yep.
Okay.
So my first deployment was to Bagram, Afghanistan, in the ICU. Then I went to Bastion, Camp Bastion, which is Afghanistan. That was more on a flying assignment. Next one was Ramstein, Germany,
Gotcha.
where you're flying both directions, both downrange and then bringing all the patients back home. It's another reason I liked AE too, where you're bringing your guys home. Means a lot. Means a lot. Next one was Kabul, Afghanistan. I was on the ground, but working with the flying. I was actually mixed with the Army, mixing their fixed wing or our fixed wing with their rotary.
A lot of time in Afghanistan.
Yeah,
Good for you.
my home away from home.
Yeah.
And the last one was Kuwait. So
Yeah.
more like a clinic there. Otherwise, various TDYs all over the place. If you're medical, you will go on TDYs San Antonio many times. It's where we go for a lot of things, but
TDY for us is temporary duty. I know we speak a lot of acronyms.
yes.
Temporary duty. Yeah.
Otherwise, between TDYs or getting to see things while deployed or in various locations, I've been all over Europe. Cadena, Guatemala, Chile, did an air show there.
Kadena, which is Japan.
Yep. Guam, Hawaii, everywhere, all over the U.S. So had I stayed a civilian nurse,
Never.
no, I wouldn't have seen all these things.
No, not at all.
No.
Same as me. Fire department, I never would have been able to work, with the partners I did and see the places I've been.
Yep.
Definitely the most rewarding part, in my opinion. Okay, we spoke assignments, travel opportunities. Let's talk benefits. Obviously, there's a ton of benefits we tend to overlook as military, especially those of us that have been in for a while, 10 plus years. Benefits kind of fade. A lot of stuff just seems accustomed. What do you think, looking back over your 17 years of serving, has been the biggest benefit for you or your family?
It's hard to say the biggest, because I feel like I still recognize all the benefits. It still blows my mind that I can go to dental or whatever and get care and like nobody asks for payment or anything when you leave. Yeah, it just doesn't exist. So yeah, medical, dental, can't beat that. Education, if you want it, or I flipped over my GI Bill to my daughter, so she can go to school. Yeah, huge. And then, when you retire, what you can get out of it, these benefits just keep going. The amount of courses and classes and things, a lot of people have no idea what is out there. There are so many different programs available to everybody to definitely go after. And might sound a little cheesy, but it's just a pride thing, knowing what you've done. Yeah.
We're a small percentage.
Very
Small percentage of the nation that serve now, especially. Air Force is even smaller when you look at that bubble. So. Education, let's go in that bubble. Let's talk education. You as the chief nurse, you probably talk education a lot. So let's talk about another acronym, HPERB. I'll let you expand on HPERB. We'll talk fellowships, and we'll leave it at that.
All right. And actually you'll meet one of my nurses out here. She keeps going for one of the fellowships. You can choose and say you come in as a registered nurse, but now you want to become a nurse practitioner or a certified nurse anesthetist, CRNA.
Right.
Any of those things, they can apply and they'll get AFIT and they'll be able to go. It's almost like a break. It still counts while you're in service. You're going to school.
Let's break down AFIT.
It's acronym wise, even I'm going like there. Yeah, I was like, think it is.
Okay.
But yeah, so they'll get selected. They will go to school. Sometimes they go to USHUs, which is our school for the Air Force. But sometimes you get to pick. I want to go to the University of X.
Gotcha.
Go spend your time there. It's still counting towards your military time while you are doing that. But then they come back and they are nurse practitioner, CRNA, whatever it was that they chose. A little time back, but
right.
What that costs them on the outside to do that, they're not paying anything.
So let's talk about that. Say someone comes to you, they just got here, they sit down with you as the chief nurse. How early from the time they get here are you talking about this education track route?
So we talk about it right off the bat because I want to know, what do you want?
Okay.
That's so I can steer them in the right direction, make sure they're on track. Typically, you got to be, we call it time on station. So you got to be here for about 2 years before, you can always ask for a waiver for everything. Before they let you apply for anything. Your initial, if you get like an accession bonus for coming in, you got to usually finish that off before, or your first commitment. And then you can start applying for these programs.
And the reason they do that is because that funding is coming from AFID as well. They don't want dual funding.
I think so, or usually not 2 bonuses, hitting at the same time, or 2 time commitments.
Fair enough.
Yeah, and then just make sure they understand what you're owing back. You can't graduate and get out. Right. You owe time back now that you have, we've given you your schooling.
For sure.
And then that will drive another assignment for them too. As soon as they graduate, or right before they're graduating, they will know you will be going to this base now.
And that's based on whatever that fellowship is for, like.
Yeah, wherever the need is. Yeah. Yeah.
Okay. And all of those are advertised through HPERB, correct?
Yep. And they will do multiple telecons or briefings throughout the year on what's coming up, the amount of numbers, like how many pediatric nurse practitioners or family care or women's health, what are changes each year on how many they need. They do also have programs for some people go on their own on the outside and go ahead and get those degrees.
Right.
And then you can ask to be granted, let me switch over. So they'll take a certain number of those as well.
And that's HPSP, Health Profession Scholarship Program, you're talking?
No, these they kind of call it a homegrown thing because they went and did the schooling all on their own. Like they may be working as an RN and all their off time, they're going through getting it done. Yeah,
Gotcha.
Don't see that quite as often because it's hard to get their clinical hours in.
So those opportunities, you can ask your recruiter about those. HPERB, Health Professions Education Review Board, new guidance comes out every single year for that, for different fellowships that are available. Also, chief nurses have that information as well. Recruiters, if you're wondering where you can get that, reach out to your chief nurse. Let's talk military versus civilian. You came in fully qualified. How many years of experience did you have?
4.
Okay, so you can speak to this a little bit then. So military versus civilian, how does this differ from what you were doing, crit care civilian versus crit care Air Force?
The care portion of the patient, with the exception of the deployed, didn't really change, but it was everything else that came into it. Like, I'll have to leave to go do some readiness training, or I'd be out qualifying on shooting. And I remember just kind of smiling like this would never happen in my civilian job. Or Humvee training, or just putting up tents, different things that we get to break away and go do. I like those things. And it just very different that they're never going to get that experience. Again, the traveling, going everywhere. There's a lot of nurses who've had to pick up COVID was one, or 9/11, Katrina. When big events like that may happen, they may grab a bunch of, folks and be like, nope, you need to deploy or go to that location and assist and help there.
For sure.
So just different all-around experiences in that manner.
Okay. Last question before we break. Military versus civilian we spoke to, but endless opportunities and pay available throughout the nation for fully qualified right now. Nurses make big money on the outside, and even new grads as well. If someone out there right now is thinking about maybe this, or maybe really just a nursing path in general, why Air Force? If you had to sum it up, one word, why this?
Ooh, one word.
Why Air Force?
Why Air Force? Really, everything is taken care of for you.
Okay.
We're going to get, the base pay might be a difference, but I'm getting a housing allowance, a food allowance, all of these things. When I move, they take care of it, move for me. I'm getting more world experience than they are. Grass is not always greener on the other side. There's always good and bad to everywhere you go, but I like all the different things I've seen, everything I've learned, experiences. I've definitely grown as a person and changed. I'm glad I came in. It's made me stronger. I probably wouldn't have leadership traits behind me as much had I stayed, civilian side.
How old were you when you came in?
About 27.
Gotcha.
Yeah.
Okay. Yeah, that age limit now, I feel like it grows every single year. We're recruiting all the way up to 47 now on the fully qualified side.
Yep.
Pretty wild. All right, so I think that's a wrap. We won't stop videoing yet, but in closing, I would like to thank the 9th Med Group for hosting. This is their conference room, 9th PA for making this happen. Without their technology, the microphones, the post-production, none of this would have happened. Furthermore, check out our show notes. We will leave our speaker's information, her information. If she's able to reach out to applicants, I will leave her information in the show notes. It's totally up to her. As always, if you're interested in recruiting specific questions or interested in learning more about Air Force, check out airforce.com. You can apply there as well. If you're currently a nurse or graduating with your BSN within 1 year in the Bay Area, NORCAL RENO area, you can apply direct with us at our org box. That'll be listed in the show notes. And until then, peace.